you were the first to organize a conference in Southeast Asia of the INPP, which took place in 2018. And that was the first conference that brought Buddhist philosophy and practice very strongly into the heart of what we've been doing in this area. So Michael, very good to see you. And may I hand over to you to tell us a bit about what you've been doing in Hong Kong.
Yeah, thanks, beautiful for the kind introduction, and thanks for having me. And it's really good to be here. I mean, although it's in cyberspace, but it seems that I'm just next to you, all of you. Over the next 5 minutes or so, I'll try to give my colleagues here an update on values-based practice in Hong Kong. Next slide, please. So I'll focus on four major areas: networking, publication, clinical, and teaching. Next, please. So we are a newcomer, so to speak, onto this scene of psychiatry and philosophy. So we are actually, as Bill already mentioned, 2 years ago, we managed to host the 20th annual Conference of International Network for Philosophy and Psychiatry in Hong Kong. And on that occasion, we managed to bring together colleagues from different countries in the area. So starting a kind of relatively informal network, Hong Kong, which is part of China now, Tokyo from Japan, Australia, where I've actually spent nearly a quarter of a century there, colleagues from New Zealand. So we are building up a Asia or North Asia Pacific network. And so my various roles over the past few years, I was at one time the chair of the section of history, philosophy, ethics of the Royal College there. And the section actually is very active. And so they're paying a lot of attention to values-based practice. And also my role with WPA also allowed me to actually continue to build network across this region. Of course, the challenge, of course, will be actually to really kind of connect with colleagues in mainland China. But at the moment, we are going, while China is actually relatively well in terms of the control of COVID-19, Hong Kong is at the moment going through the fourth wave of the outbreak. So a lot of social restriction, and that has indeed actually kind of slowed down the networking a bit. Next, please. So through this network, we actually also managed to bring our kind of collaboration together, and actually have contributed 8 articles to the up and coming publication, The International Perspective in Values-Based Mental Health Practice. And so contributors from colleagues in New Zealand, in Melbourne, and in Hong Kong, in China, and Bill already mentioned the Venerable Sid King Hong is one of the leaders of the Buddhist community, and indeed the acting director of the Buddhist Center in the University of Hong Kong. And he was actually one of the keynote speaker at the INPP annual conference 2 years ago. And as we already highlighted, so it has actually, I would say, bring in a new milestone and really kind of bringing the East and West into dialogue on the relationship between philosophy and psychiatry. Next slide, please. So the third area where we have been trying to really apply values-based practice are the clinical area. So my interest is in neuropsychiatry, neuroimaging, and so my program there, we has been using, as we already mentioned, the hermeneutic approach to basically facilitate the dialogue between different discourses in our daily practice of psychiatry, biological, psychological, social, cultural, and in particular in Hong Kong, which has a mixture between Chinese, secular, and the Anglo-Saxon kind of a culture, and it actually is a ground for very fruitful kind of dialogue between different the evidence-based psychiatry and value-based practice. So I actually have summarized some of these endeavors in one of the articles in the upcoming handbook as well. So our department is one of the leading center in early psychosis, and stigma and spirituality has been and one of the approaches used in really facilitating the understanding of people who have unusual experiences and provide a kind of discourse for them to express their experiences and allow people to actually make sense of that. And over the past 12 months in Hong Kong, apart from the COVID outbreak, last year we had actually a very significant social event and lots of youth protest and resulting in a more direct involvement from the leadership in mainland China, resulting in quite a few new legislation, have major impact on the current political system. You folks in the UK probably still remember the joint declaration between the British government and China. Hong Kong used to be a British colony. And so there is this notion of one country, two system, which will be in full transition to a one country, one system in 2047. But the recent changes have kind of actually accelerate this transition and has a lot of impact on youth, on the identity, on the sense of meaning and hope. And so a lot of kind of negative effect on their mental health. And so we find values-based practice present a kind of approach to make sense of this socio-political and mental health issue. So in Hong Kong, in our department, I'm also running a women mental health. So the roles and gender issues are particularly sensitive in our culture. And so that is also an area where we try to apply values-based medicine. And in Hong Kong, although it's predominantly a Chinese community, but we have up to 10% of ethnic minority, and many of them are actually from South Asia, Indians, Pakistanis, and Nepalese. And recently, we actually had a tragic fire incident. 5 families, they celebrate the festivals of the New Year and end up in a fire, resulting in 7 deaths and 13 kind of serious injuries of families, and a lot of so kind of community concerns about how actually deprived and neglected they have been in terms of their physical and mental health. So we actually have launched a rapid response kind of service to them, and during that period of this involvement, we also have this opportunity to kind of think about how values-based practice is applicable to daily practice. So we'll go to the last area of our applications, the teaching. So
Michael, sorry to interrupt, but we will need to draw your session to an end very shortly. If you could be fairly quick with this. Yes.
So the so we'll be undergraduate. We will include ABP into psychiatric ethics, and also we are running a master program on psychological medicine, psychosis, and society modules that will also include with BP. So So in summary, so we're looking forward. So hopefully we'll continue to expand the network. We will try to really get our kind of work published. We'll broaden the clinical applications, and we'll include VBP into our new courses and modules. Thanks for your attention. Thank you.